Dental management considerations for patients with coronary artery disease is one of the 5 markers from the subject of oral medicine. Coronary artery disease is the leading cause of death in people above the age of 45 years. It is caused by atherosclerotic plaques in small arteries like coronary vessels. Risk factors for coronary artery disease are increased cholesterol levels, mainly the low density lipoproteins. Drugs used for coronary artery disease are antiplatelet drugs like aspirin, antithrombotic therapy including warfarin and heparin, beta blockers, sublingual or intravenous nitroglycerin, or isosorbide mononitrate or dinitrate orally, or thrombolytic therapy, mainly streptokinase. First protocol is medical history and consultation. Thorough medical history should be obtained, including detailed information about the patient's coronary artery disease, including the history of angina, myocardial infarction, stent placement, or coronary artery bypass graft surgery. A list of current medications the patient is taking, especially antiplatelet drugs like aspirin and clopidogrel, and anticoagulant drugs, example warfarin. Cardiologist consultation. Consult the patient's cardiologist to determine the patient's cardiac status and obtain medical clearance for dental procedures. Second protocol is to assess the risk. Evaluate cardiac risk. Assess the severity and stability of the coronary artery disease. Patients with stable angina or a history of well-managed coronary artery disease may have a lower risk compared to those with recent heart attacks or unstable angina. Modify the treatment plan. Consider the need for modifying the dental treatment plan to reduce the risk of a cardiac event, including postponing elective procedures if necessary. Third protocol is medication management, antiplatelet and anticoagulant therapy. Do not discontinue antiplatelet or anticoagulant medications without consulting the cardiologist. Stopping these medications may increase the risk of a cardiac event. If the dose of aspirin is between 40 to 325 milligrams per day, then there is no need to discontinue the drug. Local hemostasis. Use local measures to control bleeding such as pressure application, hemostatic agents, and suturing if the patient is on anticoagulant therapy. Stress reduction protocol. Schedule shorter appointments in the morning to minimize stress and fatigue. Use sedation techniques such as nitrous oxide or prescribe anxiolytics, example diazepam, if the patient is particularly anxious. Ensure adequate local anesthesia to avoid pain and stress, which can trigger angina. Monitoring and emergency preparedness. Monitor the patient's blood pressure and heart rate before, during, and after the dental procedure. Keep emergency drugs, example nitroglycerin, oxygen, and equipment like automated external defibrillator readily available. Be prepared to manage potential emergencies such as angina or myocardial infarction. Train the dental team in basic life support. Specific dental procedure considerations. Opt for minimally invasive procedures when possible to reduce stress and bleeding risk. Provide detailed postoperative instructions including pain management and signs of potential complications that warrant immediate medical attention. Thank you for watching. If you appreciate this video, do hit the like button and please subscribe to my YouTube channel. Stay tuned for further videos.